Subcutaneous injections are used to administer small doses of medication below the surface of the skin. The subcutaneous route is commonly used to administer insulin, allergy shots, heparin, and certain immunizations such as the MMR, IPV, and VAR. Subcutaneous injections are most often given in the fatty portions of the upper posterior arm, abdominal area, and the upper thighs, using a 25 to 26 gauge needle. Needles typically range from 1/2 to 5/8 of an inch in length, and the injections are administered at a 45 to 90 degree angle. MA tip. Insulin syringes usually come with needles that are much smaller than other standard needles used for subcutaneous injections. Diabetic patients must learn how to rotate their injections to avoid irritating the tissue. Enter the exam room with a prepared syringe and greet the patient. Check the patient's chart for allergies, then explain the procedure and purpose of the medication. Wash your hands and put on clean gloves. Ask the patient to relax the arm, leg, or abdomen. Use an antiseptic swab in a circular motion to clean the skin at the site and allow it to air dry. Remove the cap from the needle. Pick up a cotton ball with the other hand. Pinch the skin to elevate the subcutaneous tissue and hold the syringe between the thumb and forefinger of your dominant hand. Inject the needle quickly and firmly, using a swift motion at a 45-degree angle, then release the skin. The dominant hand should continue holding the syringe toward the bottom of the syringe, and the non-dominant hand that was pinching the fat should now grasp the back of the plunger. Pull back on the plunger to ascertain that the needle is not in a blood vessel. If blood does appear in the syringe, remove the needle and start over. If no blood appears, continue by slowly injecting the medication. When finished, apply gentle pressure to the skin above the needle with a cotton ball. Withdraw the needle. Slide the safety sheath over the needle and discard the needle into a sharps container. Stimulating circulation improves drug distribution and absorption, so unless contraindicated, gently massage the site. Check to see if the patient needs a Band-Aid. Remove your gloves and wash your hands. Assist the patient into a comfortable position and have the patient wait the proper amount of time according to office protocol. Then document the procedure, making sure to record the name, strength if applicable, the location, the amount given, the route, doctor's order, how the patient tolerated the injection, and in some cases the name of the manufacturer, lot number, and expiration date. Sign the entry following office protocol. Check the patient at the designated time and record any unusual findings. Notify the physician if there is any local or systemic symptoms.
I remember a specific incident where a patient went into full anaphylaxis shortly after receiving an allergy injection. One minute, the patient was sitting up and chatting, and the next minute, the patient was grabbing his throat and saying he couldn't breathe. The nurse that was with me got the patient to lie down, and immediately his eyes rolled back into his head and the patient became unconscious. The nurse instructed me to go get the physician while she drew up the epinephrine. The doctor entered the room immediately and gave the order for the epinephrine. The patient regained consciousness shortly afterwards and ended up being okay. The patient had taken allergy injections for 6 years with no prior reactions. That incident taught me never to take injections for granted. Always have epinephrine in the room when you are administering injections. You never know when an emergency will happen.